Welcome back. I'm Maggie, your host of Neighbors Helping Neighbors, the podcast from Father Joe's Villages. In this series, we explore homelessness, its causes, and solutions to the issue. Our guests include experts and leaders in the space, as well as folks with lived experience and unique perspectives on homelessness. To learn more about our mission, visit us at neighbor.org and follow us on social media at Father Joe's Villages. Last episode, we introduced the Making Health a Priority pillar of care. We focused mainly on physical health, and today we'll delve into behavioral health, which includes both mental health and substance use. To explore this topic with me, we have Marissa Veron, CEO of McAllister Institute, San Diego's largest treatment service provider. And from Father Joe's, we have President and CEO, Deacon Jim Vargas, and Jenny Wilkins, our Supervisor of Outreach for our Street Health team. Welcome. Thank you so much for being here.
It's good to be here. Thanks for having us.
Thank you for having us.
Can you start by introducing yourselves and what you do, a little bit about your organization?
Sure. So my name is Marissa. Thank you so much for the warm welcome. And as you mentioned, I'm the Executive Director at McAllister Institute, where I have been serving for the last 12 years. I started in this journey based on my grandmother's own recovery, 67 years actually as of Wednesday.
Wow.
And
Great.
I know that so many of the gifts that I have in this life are because of the recovery that she found. And so when I had an opportunity to join this work, I knew that they were going to be very, very big shoes to fill, but shoes that I certainly wanted to walk the same path.
Wonderful.
Hi, everybody. My name is Jenny. I am the supervisor of the street health team associated with the Village Health Clinic at Father Joe's Villages. I'm also a certified substance use disorder counselor. And my street health team really brings medical and behavioral health care out to the streets, to the community members that cannot make it into our brick and mortar clinic, just establishing relationships and, helping people access healthcare.
Right. And let me give you a sense of Father Joe's Villages just very, very quickly. The federally qualified health center, and we'll be kind of focusing, as you mentioned, on certain aspects of it, is an extremely important element. I mean, without your health, you really are not good for much of anything else, right? So we need to really address health as it relates to those who are homeless, and those who are suffering from mental health challenges, substance use disorder, and the like. And so we'll talk about that. But in addition to that, we work with children. Through our therapeutic child care center, we work with these kids who come to us. They're academically, emotionally, socially delayed, and we know they're more apt to be homeless in adulthood unless we mitigate those circumstances. So our work there is very, very important as well. And then we have our employment center. Employment is very important. We have our vocational training. And so through the various disciplines and marketable skills that we're able to share basically with those who we serve, then they're able to go forward and find employment. And then also they have income and self-sufficiency. And that's what it's all about. Shelters. We have over 1,000 shelter beds we offer each and every single night. And it's not enough. Heaven knows. We need more shelters out there in the city and in the county. But we're blessed to have over 1,000 beds. And it's not just a matter of the shelter beds, it's the meals that we serve that go along with that. It's the showers that we dispense and everything that goes along that we take for granted that are just basics, right? So we're able to offer that day in and day out, 365 days a year. We develop housing. At the end of the day, housing is what breaks the cycle of homelessness. So we're blessed to be able to develop housing. And next year, this time, God willing, we'll be breaking ground on 3 new endeavors, right? We'll offer up about 300 units in aggregate, and that's really what it's all about, breaking that cycle. But not only the housing or the shelters that we offer, but also the comprehensive services. Without those services, people wind up back on the street. So that's just very quickly what we offer at Father Joe's Villages. We're blessed that it's as comprehensive and as holistic as it is, and that's what makes a difference in the lives of the individuals we serve.
Mm-hmm. So of this array of services, why is behavioral health so important? Why should the community care?
Well, as you were mentioning, Deacon Jim, just as your health is such a huge component of our ability to function and move through this world, so too is the health of our brains. And to say that behavioral health is a separate component from health, I think isn't really recognizing that our minds, our bodies, our spirits are all connected. And for those who are living with brain diseases, really, it's so clear that we need to be able to help people get to a point where they can be living their best lives, where they have the tools and the medications that they need to be successful.
And what are you finding, Jen, out there on the street? I mean, as it relates to that behavioral health and the substance use disorder. I mean, we know that more and more people are mired in those situations. A lot of people, in fact, ask me, they assume that that's what throwing people onto the streets. And that really isn't, in San Diego, that really isn't the number one cause. We know the number one cause is an economic one. It's extremely expensive to live here in San Diego, right? Now, having said that, if you're on the street for an extended period of time and you're seeing it day in and day out, I'm sure, then you coping mechanisms you develop. You use coping mechanisms, and substance use is one way of doing that, right? If you're not suffering from mental health challenges when you fall onto the streets, in time, you develop some of them. And so tell us about that.
I mean, the conditions of the street are so rough right now. We're seeing so much suffering and so much substance use. There's overdoses, there's uncontrolled mental illness, and people are constantly experiencing toxic stress, right? And using substances is really a normal coping skill for abnormal circumstances, right? Can you imagine just being on the street, unsafe, always having to watch your back? You don't have four walls to keep yourself safe inside of. And using substances becomes the only reprieve for that toxic stress, Again, a normal coping skill for abnormal circumstances.
What kind of challenges do you see people are facing in terms of addressing their behavioral health? I know there's a lot of distrust kind of in the system, or, in when they come in contact with the folks that you're working with. How do you start working with them? What does that look like?
Yeah. So our street health team does go out onto the street and deploy into the community 5 days a week. And we do have a medical provider with the team, but providing healthcare is not necessarily the first or the main objective, because the conditions, as we've been talking, they're rough right now. As San Diego becomes increasingly more unaffordable, the unhoused population is growing. And with the ordinances and the constant encampment sweeps, people are being displaced and their things are getting thrown away. And it's no wonder that there is a hesitancy or, a resentment, so to speak, or, they don't want to engage because most of the people they're in contact with are causing them more harm than good. And so that's the beauty of our street health team, is we're not out there with our own agenda. We are out there to express compassion. We're asking questions, we're building trust, we're building rapport, and we're asking them for permission to serve them. We're asking them, how can we help you? And we're letting them tell us, and we're letting them be the experts in their own lives.
So you make connections and you meet our neighbors where they are.
I think one of the most important components that we can even start with, and some grounding principles, are a recognition that folks who are using drugs are doing so because it has served a purpose for them. And we may have judgments about whether the value of the choices are good, bad, but really at the end of the day, part of humanizing this is remembering that it is serving a very distinct purpose. And I think even as a basis for treatment, when we can approach folks like that, it's so much easier to actually start to problem solve and to listen and to have them be the authors of their own care. I was recently doing a panel to a lot of folks who are very powerful, but not necessarily in the streets. And I said to them, imagine this. If I were starving, absolutely starving, but I had a shellfish allergy, and you offered me a plate of shrimp, and I said, no, thank you, I can't. It will make me sick. We would definitely not conclude that food is not the answer to ending hunger. We certainly would not blame me for not eating the shrimp. And so I think those sorts of just moments of remembering that maybe what we're offering out there isn't always what people want, but they do have a sense of their own use, the times that they've been able to string together some days of sobriety. And I think unlocking that potential in folks out there is really such an important component of any care we provide.
Mhm. And addiction is so complex. Like you're saying, abstinence isn't necessarily the answer for everyone. What other kinds of options are out there?
Well, I love that our toolbox is growing. I think for a long time, abstinence-based care was the only care that was available. And by all means, there are folks who are living with decades of sobriety and who that has worked and
Right.
for whom it will continue to work. And there's other people that in the confines of an abstinence-only program or with that as the expectation, it's exacerbating shame. It's causing them to never walk in the door.
Right.
And we're seeing, 1,300 overdose deaths. I think if we're looking at what our choices are and it's abstinence only and people die on the streets because they can't meet those expectations, we start to evolve what we can do. And we're really lucky now that we have medications available. We have interventions like contingency management is a statewide pilot right now, which is really one of the only evidence-based treatments for stimulant use disorder. And of course, there's always the therapies and in group and individual family support. There's so many different components. And like you were saying, Jenny, it really comes down to finding the right services that someone identifies and that they know that they need.
That's absolutely excellent. I mean, the just meeting them where they are, right? And just that is making such a difference because it's not judgmental, right? And it's providing not a cookie cutter approach, but it's recognizing that everybody's situation is unique. Their circumstances, their backgrounds, their traumas, they all come into play. I mean, if we expect sobriety from everyone, then we're really relegating a number of them to remain on the streets and to deaths. You use that 1,300 figure, and that's the general population, right? But within the homeless population, right, they've been out of the 600 individual deaths on the streets in this past year, 300 of them have been because of drug overdoses, fentanyl especially, right? And so, that's not what we want. We need to reach these people. We can't help them. I've said before, we can't help them if they're dead. Right? We have to meet them where they are so we can help to keep them alive and then show them that they can really live, right? Because there is a better way, obviously, so they can prosper.
You opened up so many segues for a good conversation. And one of the first things that I wanted to comment on is you had mentioned like there used to be the only option was abstinence-based programs. And you're absolutely right. So I am in recovery. I've been in recovery for 8.5 years now, but I was struggling with, thank you. I was struggling with substance use for 15 years. And that was it. It was either I was using and I was hanging out with people that were supporting my using, or I had to go into treatment and face abstinence and deal with all of these underlying issues without the use of substances. And there was no in between. And I wasn't ready to stop using because, like you said, using was a coping skill for me. It was providing me something. It was providing me some comfort. It did something for me. And I wasn't really ready to give it up. But now today we have harm reduction treatment programs like we do at Father Joe's Villages, our Transformative Recovery Services program. It's our outpatient program. It's low barrier, and abstinence is not required to be involved in this program. So our counselors, our group therapy, it's literally meeting our clients where they are at, no matter where they're at in this stage of change. And we're saying, hey, I see you. I know it's hard. I know it's difficult, but I am going to walk through this with you. I'm going to support you through wherever you're at, and we're going to get through this together, because not everybody wants to stop using. Some clients can continue to use, but they can use in a way where they're still able to hold a job or pay their bills, or they're not getting arrested, or, they are able to have, healthy relationships. And that's okay. If you can do that while still using, I'm going to support you in that. If you can't do that and you do want to quit using, I'm going to support you in that too. But no matter where you're at, I'm going to hold your hand and I'm going to walk you through this. And that's the key of harm reduction. It's those connections. It's those relationships. It's, I see you. I'm here for you. Let's do this.
Particularly as using drugs is becoming cheaper and more dangerous. There's a lot of talk about fentanyl. Deacon, you mentioned that. Tell us a little bit about what fentanyl is and why it's so dangerous.
So fentanyl, oh, wow. Excuse me, let me start over.
Words.
Turns out fentanyl is harder to say than shrimp. So fentanyl is a synthetic opioid. And like you mentioned, it is cheaper than many of the drugs that we're seeing. It has largely displaced heroin in the street market. Unfortunately, it is not the only substance that's out there. Actually, meth is still the number one drug of choice that we see. And really what's also rising is polysubstance use. Folks who maybe have fentanyl in their drug supply that they didn't know, but also some folks who are choosing that as the ideal high and what they're hoping to pursue. And so when you were talking about, safer use and harm reduction, I think there is this growing public sentiment and stigma around harm reduction where it's kind of this dirty word, but really at the very, very core of it is meeting someone where they are and seeing them as a human being and valuing that they have agency in their lives. And as much as it's walking alongside someone, it's also walking just half a step ahead of them and surrounding them with a community that maybe they're not ready to start using, or I'm sorry, to stop using, but they're in the presence of people who are successfully doing it and they see a model and they think, hey, all these years I thought I could never have that, but people are still opening their arms to me and they're still telling me to come back. And maybe if I do quit, I won't lose every person I've ever known. All of the people that are surrounding me, I feel so alone. All of my family members don't want anything to do with me. But here we are, just a smidge of a step ahead and really using those principles of attraction and hoping that it really is the off-ramp to getting someone, the healthy, happy life that they dream of.
And they do have dreams. You're absolutely right. I mean, you mentioned, Jenny, transformative recovery services. And over this past year already, it's been 1,600 services that the federally qualified health center has dispensed, right? Think about that. And within that, it's on medication-assisted treatment, the use of Suboxin to wean people off of those opioid substances, right? And so that's exciting when we walk with someone, we're able, and maybe just a step ahead. I like that, Marissa, and there's that break, right, in the dam almost where finally, they want just off the air. You mentioned to me just a young man in his 20s, right? And was it just this morning, Jenny, that you encountered him? And what did he say to you?
So we've been working with this young man for about a year, early 20s, living unsheltered on the streets. And he's grown very near and dear to the street health team. We all see him and we embrace him, we give him hugs. But he has been struggling with use of fentanyl for a long time. And literally just this morning, we're out in the community and we run into him and he said, hey, I'm ready to start Suboxin. I'm ready to give it a shot. Wow. He's planning to go see his family for Thanksgiving. And he was like, I don't want to be using. And so he was ready to start today.
Right.
So is Suboxin, is that part of the MAT treatment then?
Correct. So it's medicated assisted treatment. It's it's buprenorphine, which is an antagonist, which helps people, it dissuades against the withdrawal effects from the opioids in the system. And so it helps people move through the withdrawal symptoms without using.
Right.
And that kind of speaks to, again, that recovery looks very different for everyone, and treatment looks very different for everyone. So maybe if you're going from using heroin to using maybe cannabis, or from using fentanyl to getting on the MAT treatment. So everybody's story is valid and everybody's looks different.
It is, but I think the story that you told just about the 20-year-old gentleman does also underpin the importance of access. And, you've been working with him for a year, and today is the day that he wants to make a change and spend Thanksgiving with his family. Thanksgiving is is on Thursday. And so if we miss him in that moment,
Exactly.
the motivation that
Exactly.
he has today, circumstances may
Yes.
change. And
Yes.
so we have to
Yes.
make sure our doors to treatment and to medication assisted treatment are as wide as humanly possible.
Right.
Same day access is so important because we cannot miss that moment. We have to strike when the iron is hot, especially with people living unhoused, unsheltered on the street. Like you said, their situation can change in an instant.
That's right.
You know, I'm ready now. So let's get them the help they need now, because tomorrow they could be moved. We might not be able to find them. They could have a whole nother issue going on. And you know, tomorrow will not be the day.
And I have to give a huge shout out to your federally qualified health center, because I remember even early on in the days of medication assisted treatment, you all were some of the first who were willing to do same day inductions and to do inductions that a lot of providers felt were unsafe because people were not housed. But I think you're prioritizing keeping people alive and recognizing that, you know, people who have the resources to stay clean for some amount of time, that is so important, and we have to continue to support them. But we also have to reach deeper into the folks who don't have the resources to even piece together a safe place to keep their medications.
Right.
And so just thank you so much for that. It's been a huge game changer, especially for our adult detox program, which, as I'm sure many of us in the community know, is one of the most impacted resources that we have.
Right. In fact, we don't have enough detox
77 beds for a population of 3.3 million.
in the entire county. Can you imagine?
Wow.
So we need more detox beds. We're focusing on that, Marissa. All right, at Father Joe's Villages, we need more detox beds, and maybe we can partner in that regard, right, for the going forward. I mean, again, people are dying, right? They're dying on the streets, and so that's an important element as well.
Tell me more about the tools that you have to keep folks alive. I know you have some new vending machines at Father Joe's, correct?
We do. We have vending machines with 24/7 access. And what a community member needs to do is just input a little tiny bit of information, and they'll get a unique identifier code. And they can use that code any time of the day or night to access products like naloxone or Narcan. We have fentanyl testing strips, so people can test their substances to see if fentanyl is in it. We have Xylazine testing strips, so they can test it for Xylazine. You know, and that's so important because people need to be aware of what they're ingesting and the risks they are taking when they are choosing to use. We also have wound care kits. What else do our vending machines have?
Well, the wound care kits, by the way, are extremely important as it relates to Xylazine, especially, right? I don't know if you want to talk about that, but and Xylazine, and we should describe Xylazine. I mean, that's just new on the market as well. When I say new on the market, it's been around, but I mean, it's finally hit San Diego. We knew it would, and it's been now in the last few months, and that's really concerning me, Xylazine, because as we move forward, that's something that if you have open wounds, you can wind up with amputations as a result. So those wound care kits are so important. Did you want to describe Xylazine?
Well, I'm
Marissa?
actually really curious. So we're not seeing a ton of Xylazine show up yet. I know there's talk and awareness within the community of people who use drugs, but we've actually not had any cases yet. I'm wondering if it's because our outreach hasn't been targeted, or if it's just not made it to San Diego. Jenny, are you and your team seeing it out there yet?
I want to share that there was an organization that took a drug testing kit out into the community recently, and out of 100 samples, there were 68 that were positive for Xylazine. Wow. And this was unbeknownst to the people that supplied their drugs for the testing. Right. So it is out there, and I just think that people are not aware.
They're not aware.
And that is why it is so important to have our outreach workers going out into the community, dispersing these Xylazine testing kits. We also have Xylazine information that we're providing, and we're having these conversations and saying, hey, you may not know it, but your drugs may have this in them. So this is how you can test it. This is how you can educate yourself, and this is how you can learn about it. And then we have those conversations and we continue to talk about it. And a lot of the people, community members will sit and they'll engage in those conversations because they want to know, they want to be aware.
They don't want to die.
They don't want to die.
Right. Right.
And so the drug game is always changing. We have to change our tools and our approaches to it as well, you know. And that goes with harm reduction as well. That even though it's supported by addiction specialists and even the CDC, some people have trouble grappling with it. And what would you say, you know, to community members who maybe misunderstand it or who are trying to deepen their understanding of it?
I feel like I've maybe already said a little too much on this topic. So,
You know, again, I want to bring it back to my own personal experience. I can understand why some people may have a hard time getting past, like, oh, it's enabling, you know. But I want to share that I personally, I was not ready to stop until I had made that decision and I was ready to stop, right? And so people are going to use no matter what. So, like you said, it's so the main objective is let's keep people alive and let's keep them healthy. So, if you're going to use in a more safe way so that you can stay healthy and have a better chance at making some decisions that are going to improve your circumstances, right? You know, I used for 15 years and that space is such a lonely, tormenting space to be on. Not a single day did I wake up and not want to stop using. I just did not know how. And there was nobody supporting me through that. I really truly believe that if I would have had someone who I could talk about like my internal conflict with, you know, I felt like a hypocrite because I was using, but I wanted to stop. And I had nobody to work through those things with. And if someone would have been in that space with me, kind of, you know, affirming my strengths and believing in me when I didn't believe in myself, I really honestly believe I could have reached recovery a lot sooner than I did. You know, there was a lot of trauma. There was a lot of risky situations. There's a lot that I went through that I believe I probably didn't need to if I would have had somebody supporting me in that space.
The story that you just shared is something that we hear a lot at McAllister, and we're so fortunate that part of our recovery-oriented culture is that we hire so many folks who have gone through not just McAllister, but other programs as well. And it's been a slow-moving cultural shift in embracing harm reduction, but I think the turning point for so many people who have long-term recovery is realizing that maybe if there had been a compassionate person who had helped me develop a little bit of confidence or who accepted me for exactly where I was, then maybe I would have had a few years less out there. And you can't go back and rewrite history, but I think it does help to bring together the lived experience in a way that is not stigmatizing to someone who is not in the same place, but is really evolving and realizing that, you know, this disease is one that grabs your brain, that you want a substance more than water and more than food. It is so powerful. And I think until, you know, I don't know how that community education works, that we really start to understand how strong of a grasp a drug has on someone. But I think a starting place is realizing that I don't think anyone who picks up a drug for the first or second time wakes up and thinks, hey, I'd like to be an addict.
Right.
I'd like to ruin my life and all of the close relationships that I have. I'd like to lose my job. No one wakes up and thinks that. And so I hope at least one of the starting points for our community is real compassion around the depth of what a hold substances can have on your brain.
And then the change in that brain chemistry, actually, and that's the key. And I think a lot of people don't recognize that you're really not yourself in a sense anymore, right? And so that's an important element. Yeah.
And on that line, McAllister was one of the first programs in the country to actually allow women to live alongside their children while receiving treatment. And one of the things that we see are mothers acknowledging that the grasp of drugs was so strong that even their maternal instincts were captured. And having services that can help them accept the shame, move forward, hear from others that there are ways to repair those relationships, that there's skills that they can learn, ways that they can make amends. It is so powerful. And I think the thing I hope the most that people will hear, whether you're using or you have a family member, is that recovery is possible. There are thousands, millions of people who are living happy lives, wonderful lives in recovery who thought it may never be possible for them, and yet it is.
It is. And so the medication-assisted treatment is great, but the therapeutic aspect needs to be there as well. The therapy has to be there because there's so much brokenness in the whole process that you just described, right? And that's where, I know at Father Joe's Villages and the health center, the mental health services that are offered, day in and day out, part of it through the street health, but then also now brick and mortar is so very important, whether it's one-on-one therapy or group therapy. That's an important element, right? With it, in the absence of that, medication-assisted treatment can just go so far, right? Because you're still mired in that psychological aspect of it, right? So I mentioned housing before. When we try to help individuals, but we need to get them into housing, because trying to cope with all this while remaining on the streets, it's extremely difficult, right? So there's so many aspects of this, and that's so very critical. You had a story that you were sharing.
Yeah, I did. To the naysayers or the people that have a hard time believing in harm reduction, I have a really powerful success story that I wanted to share with you all. I had a young woman who walked into the clinic one day, and she wanted to start counseling. She was using methamphetamine intravenously multiple times daily. She had a history of sexual trauma, PTSD, body dysmorphia. There was a lot going on, and she was not ready to quit, but she would come see me faithfully once a week, sometimes twice a week. And we would sit together in this space and we would talk through all of these challenges. She was not motivated to go to treatment. She did not want to stop using. She had resentments against the 12-step fellowship. She was just not at a place where she was ready to move through the stages of change. But we worked together week after week. And eventually she comes to me and she says, "You know what, Jenny, I'm tired. I'm ready to go to treatment." And I jumped for joy. Internally I was celebrating and I was just so excited. We got her into residential treatment a couple days later. She successfully graduated from that treatment program. She is now in a sober living and she's going to outpatient. She passed her certification exam to be a peer support specialist. Wow. And she is doing amazing. My heart just bounces out of my chest. And yes, she has this wonderful support network group of people in sobriety that she has, built along the way. But the coolest thing is who she still reaches out to when she has a challenge or when she's going through something is me. Mm-hmm. She still reaches out to her primary care provider at the Village Health Clinic because we have been through this whole journey with her. And it's just so beautiful. This young woman who came in broken and alone and scared, never thinking that she could have a life that meant anything, is now just killing it,
Yeah. That's great.
And it's because we worked with her. We met her where she was at. We never pushed, we never rushed, we never judged. We just sat with her in that space, and we believed in her when she couldn't believe in herself. And now she's just doing amazing.
Great feeling, huh?
That's so proud.
Yes.
Proud.
Yeah. Proud of you.
Yeah.
That's a beautiful story.
Thank you.
And you gave her that time to develop those healthy coping skills, to build a small community so that when she was ready to take the jump she had a community around her. It's beautiful.
It is beautiful.
Thank you.
Thanks for sharing that, Jenny.
Such a great message of hope from all of you. Can you tell us a little bit about how folks can access McAllister or if they need help with resources?
So McAllister, I have to start by just saying that we're one of 36 amazing providers here in San Diego. And I say that because it's so important to know, yes, we do provide a lot of services. I happen to think we do some of the best care, but really there are a lot of doorways to walk through. And For McAllister, we have 26 different programs that span all the way from Escondido to San Ysidro and just about everywhere in between. And we really pride ourselves on the fact that we have services across the age continuum, across different levels of care, so that we can help folks move from withdrawal management to residential to outpatient and sober living. And that's in recognition of the fact that change this significant doesn't happen overnight, but we really want to be there through each and every step for the people that we serve. And to that end, we have a founder and CEO who is so singularly committed to Access that she actually gives out her personal cell phone number.
I have
And
her personal cell phone number.
yeah,
I do.
and not a lot of people are as good of a care coordinator as Jean McAllister. So I am going to provide her phone number here. That's okay.
Sure.
Area code 619-987-6393. And she really does take calls from 6 to 11.
Wow.
Thank you.
Wonderful. Thank
That's
you.
And
really great.
texts.
And text.
And text. Jenny knows as well. I can tell. All right, it's great. That's
Well,
great.
thank you so much for being here again. This is obviously such an important topic to not only our organizations, but to our community at large. So thank you for your time.
Thank
having
you.
us.
It's been a pleasure to be with the two of you, by the way. Thank you. And with Maggie, of course.
And thank you to our listeners. We'll see you next time. Thank you for joining the conversation today. Our next episode of our Neighbors Helping Neighbors podcast will air in 2 weeks. In the upcoming installment, our spotlight will be on Investing in Children, Pillar of Care. How are you going to get involved this year? Remember, you can make a difference by volunteering, donating, and taking action today at neighbor.org. We're all neighbors helping neighbors, and together we can do better. Thanks, everyone.